Hello, my name's Felicity Cohen. I'm the CEO of WeightLoss Solutions Australia. Welcome to our webinar today where we're going to address the procedure, the Endoscopic Sleeve Gastroplasty, or more commonly known as the ESG. One of the things that I'm really excited to offer patients with the ESG procedure is the fact that it is an endoscopic or non-surgical intervention. And I think this is a fabulous new innovation for patients who actually don't need a surgical procedure, that we can offer something that is innovative and permanent to achieve a sustainable weight loss outcome. Once you've had the ESG procedure here at WeightLoss Solutions Australia, you will have the opportunity to work with our entire multidisciplinary team over a 12-month period. And that's one of the things that is the most important aspect of your care in our hands, is working with the nurse, the dietitian and the psychologist on your Lifestyle Modification program over a 12-month journey. And today you'll have the opportunity to hear from each of them about their role and to answer some of your potentially most frequently asked questions in relation to the ESG procedure. I hope you find this informative and that we answer as many of your questions as possible, and we look forward to meeting you in the clinic.
So my name's Graham Rich. I'm a gastroenterologist. I do weight loss procedures, including the endoscopic sleeve gastroplasty, and I've been asked to talk today about the details of an endoscopic sleeve gastroplasty and what patients should expect, and some of the details around what the procedure actually is and what you need to do to work yourself up for this procedure and to work out if this is the procedure that's right for you. My background is as a gastroenterologist, and I was proctored by numerous people who were experts in the procedure, including Gontran Lopez Nava, who's a gastroenterologist based out of Spain. I also was proctored by CJ Gestalt, who worked at the Mayo Clinic, who is one of the professional trainers for this procedure, who came and proctored me on my patients in Sydney when I was starting up in Australia. And since that time, my centre has done over 100 cases of endoscopic sleeve gastroplasty. We have data beyond 6 months now, which we'll talk about as we go forward in terms of what to expect in terms of weight loss. So this is not an experimental procedure. This is a procedure that's now been around for quite some time, although the longer term outcomes, 5 and 10 year data, we don't have, and that is one of the limitations, and something that I will always talk to patients about, that the patients who are eligible for an endoscopic sleeve gastroplasty are generally also eligible for a traditional surgery, whether that's a laparoscopic bypass or a laparoscopic sleeve gastrectomy. And so we always talk about the risks and benefits of all of these procedures, and one of the limitations of the endoscopic sleeve gastroplasty is the limited long-term data. So really beyond 2 years, we don't know what the weight loss will look like beyond that time. So that is a limitation. That being said, to the 2 year mark, the data looks like the weight loss is good and effective and continues out to 2 years. And so I thought I'd talk to you a little bit about what an ESG is, or an endoscopic sleeve gastroplasty is, and just some basic anatomy behind what we're actually looking to do for a patient. And so what we've got is, you've got your esophagus, or your food pipe, comes down like this. It joins onto your stomach, which hooks around like this. And then at the bottom of your stomach, you've got a valve that we call the pylorus, and that comes down into your small intestine down here. Now, just some very basic physiology in terms of how does your gut actually work. So you swallow the food down your esophagus, and it moves down with some snake-like movement called peristalsis and comes into your stomach. Now, your stomach doesn't absorb any nutrient at all. Really what it does is it takes in the food, so it accommodates the food that you eat, and then it digests up. So there's a whole lot of acid going on in the stomach, which helps to digest your food. And the stomach is a big, thick muscle that basically tries to break down all of the nutrient and all of the food that you've eaten. Then what happens, this pylorus, this bottom part of the stomach, is a very sensitive, very tightly controlled part of your stomach. And what it does is it drips out nutrient into your small intestine, and that's where the absorption occurs. So for the endoscopic sleeve gastroplasty, we're not down in this area at all. So if you were to have a gastric bypass procedure, this is the area one of the areas that we're affecting. For the endoscopic sleeve gastroplasty, what we're doing is we're manipulating the stomach from within inside the stomach using our camera. And so what we do is, patient will have a breathing tube placed in here. So you're going to have a general anaesthetic looked after by one of our anaesthetists. So the breathing and all of your bodily functions, you'll be asleep, we'll be taking care of. Then the scope, which is about this long, roughly the size of my finger, and it's got a cap on the front which allows us to do all the stitching, is passed in through your mouth, comes down through your esophagus, and comes down into your stomach. Now what we're trying to do is we're trying to take this big bag of your stomach, which is this sort of size and this sort of length, and we're trying to manipulate it so that we end up with what looks like a narrow sleeve. And so what we do is from down within the stomach, we have a stitching device on the front of our scope that we start all the way down here. There's a bend in the stomach down here. We start here, and what we try and do is we try and collapse all this down so that in the end you end up with a sleeve down here, or a narrow tube down here where the food comes. So now when you wake up and you've recovered, what happens is you swallow the food down into this pouch here, and so when the pouch fills up, the idea is that you feel full, but you can't take in as much food as you could when your stomach was very large. So with this procedure, we use stitches, the exact same stitch that we'd use if we were doing an abdominal surgery. So if you had a hernia repair or a traditional bariatric surgery, it's the same plastic stitch, which is a permanent stitch to try and mold the stomach into its new shape. And this is a permanent procedure. Now, again, this has got some good points to it. The fact is that this is likely to be a permanent procedure. It should be thought of as a permanent, non-reversible procedure that helps you to lose weight and keep the weight off indefinitely. And so for this procedure, what we do is we admit patients overnight following the procedure, because we know that the first 24 hours to 48 hours, that's when patients have the most symptoms. Now, we look after you with intravenous medications to take away the cramping pain that many patients will experience. And we also take away the nausea, which tends to be something that can trouble patients in those first 24 hours. But with intravenous medications, it's not going to be the most comfortable night of your life, but it's a very manageable set of symptoms. And really by 24, 48 hours after the procedure, these symptoms really melt away. When you go home, you'll be given medications which really take almost all of the symptoms away at the time you go home. And by about 72 hours, most patients don't have significant symptoms. One thing that patients do notice is that they have a little bit of lethargy for the first week and a half after the procedure, but really by the end of the first fortnight, these symptoms are entirely gone, and many of my patients are actually back at work. Within 3 to 4 days, some people have a week off, but a lot of people are actually back within a handful of days from the time of their procedure. And the benefit of this procedure is that there's no abdominal scars, that we haven't, because we've gone in through the mouth, there's no scars in the abdomen. We haven't actually chopped any of the stomach out. We've remolded it into a smaller shape rather than chopping out the stomach, which is different to the traditional surgical procedures. After this procedure, patients put onto a modified diet, which we'll talk about in another section of this video. And so what we know for patients after they've finished their modified diet, patients in general, following this procedure, patients have a restricted amount of food that they can actually consume. And for most patients, they've gone from a generous dinner size plate to really being able to take about an entree size plate with the mindful eating and the careful eating before they feel satisfied and they feel full. And so again, this really contributes to why patients lose weight, is they're reducing the calories that they eat without having that sort of driving hunger that makes people overeat and eat too many calories. And so if we look at the differences between an endoscopic procedure and a laparoscopic procedure, so both have their place and both have patient groups that will benefit from either of these different procedures. If we look at the endoscopic procedures, so the endoscopic sleeve gastroplasty, the patients that we know will do well are those who have an earlier metabolic syndrome. Now what that means, they're earlier in their journey. They're lower weight, so the criteria for an endoscopic sleeve gastroplasty is that you'd need to have a BMI or a body mass index greater than 30 if you also have a weight-related medical problem. So that's things like type 2 diabetes, high blood pressure, high cholesterol, obstructive sleep apnea. So this is what forms the metabolic syndrome. So if you've got a BMI of over 30 and one of these, what we would call a comorbidity or an associated disease, then you'd be eligible for this procedure. Now, if you have a BMI over 35, that's a criteria in itself that means that you'd be eligible for this procedure. Now, when we're talking about the differences between the two procedures, it's not that one is better or worse, it's that they have different patient groups that are going to do well with the individual procedures. And in medicine, we always try and use the least invasive technique we can to achieve the result that we're trying to get. And so if you're one of what we would call the earlier metabolic syndrome patients, you're going to do well with a minimally invasive or endoscopic approach. And so if you have a relatively low BMI, meaning a BMI more than 30, but probably less than about 45 and probably 50, you're going to be a good candidate potentially for this procedure. If you've got a medical related condition or weight related condition, but it's not in the late stages. So when you've got late stage diabetes, meaning that you're on high doses of insulin, you're probably going to be better off having a traditional bariatric surgery. And so it's really a horses for courses to look at which patients will do better with which procedure. The other thing that makes a bit of a difference is your ability to exercise. So if you have an ability to exercise and so change that equation of energy in and energy out, we know that the minimally invasive procedures are going to work well for you. That if you can exercise and you can really ramp up the amount of energy that you're using, these procedures are really going to help you. If you're having difficulty with your mobility and you're not able to expend as much energy by adding on exercise, then it's likely that you're going to do better with a surgical procedure. And so when we're deciding what procedure a patient should be offered, these are some of the factors that we look at. There are other factors like age. So we know that the younger you are when you have a procedure, the better you'll do with a minimally invasive or an endoscopic procedure. So again, these things don't decide which procedure is right, but they certainly shape our opinion as to how best we can treat you and how we can actually achieve the goal of getting your weight under control and trying to fix up some of the associated medical problems that you've got from having excess weight. And so whatever procedure is right for the patient, whatever procedure the patient decides, look, this is the procedure for me, every procedure is an add-on to conservative medical therapy. Now what that means is diet, exercise, and in some cases medical therapies, that these need to be robustly attempted prior to consideration of any sort of procedure, because every procedure has risk and we always want to make sure that we're doing the least invasive procedure or intervention we can in medicine to try and achieve that outcome. And so we've got to make sure that everyone has tried all of the diet and exercise, work with the exercise physiologists and the dietitians prior to any procedure, so that we know that we're putting you through this risk, knowing that the standard therapy, the conservative therapy, isn't enough and we need to escalate your care. Now, on the flip side of this, when we do a procedure, whether it's a surgery, a traditional surgery or an endoscopic procedure, it's not a magic bullet. That this is going to certainly help with your weight loss journey and certainly help you to treat your weight-related medical problems. But it's not a magic bullet. That it takes buy-in. There's an expression of beating the band. And what that means is that there's a group of patients who didn't change their diet and they beat the band by drinking high energy drinks like soft drinks or juice, and these liquid calories would beat the band that patients didn't lose much weight because they didn't modify their lifestyle. And so the example of beating the laparoscopic gastric band is something that can happen with any of the procedures, whether it's a traditional surgery or the endoscopic surgeries. And so this is why we need you to work with a metabolic team, which means psychologists and dietitians and nursing staff, and really to engage in this multidisciplinary approach to losing weight after the procedure. That patients have to think of this as not a magic bullet, that the surgery and the endoscopic procedures are certainly a help. And for the group of patients that don't lose enough weight with just diet and exercise, this is certainly a game-changing procedure. But that being said, it takes buy-in from patients, that you've got to be engaged with these teams. You've got to change your diet. The procedure will help because it's going to help you to feel full earlier and to help you feel full for longer. But you've got to take the dietitian's advice. You've got to work with the team to try and achieve these results. And the group that does that are the group that do the best, that lose the most weight and have the biggest improvements in their metabolic, so their diabetes and their blood pressure parameters.
Hi, my name's Asha Soni. I'm the registered nurse at WeightLoss Solutions Australia. I'm the first person you will meet when you come into our clinic. So today I'll be talking to you about the endoscopic sleeve gastroplasty. When can I go back to work? The first night you will spend in hospital. The second day you will go home and rest at home. And on day 3 you are more than happy to go back to work. How long till I can start exercising? Day 3 of procedure you can do gentle exercises, and a week after your procedure you can go back to your normal exercise regime. Will I have any scars? No, you won't have any external scars, as this procedure is done endoscopically, so a camera is passed down via your mouth into your stomach, and so all the sutures are internal. Will I get nausea and stomach cramps? Yes, you might get a little bit of nausea and stomach cramps for the first 24 hours, but after this it should subside. We will manage your nausea and stomach cramps with medications. Can I eat all types of food post-procedure? Yes, you can eat all types of food, but for the first 6 weeks you will be on a modified diet, which our dietitians will talk to you about. As part of the WLSA Lifestyle Modification program, you have unlimited access to me, the registered nurse, at the clinic. You can contact me via email, phones, or you can come in and see me at the clinic for the next 12 months.
Hello, my name's Leslie Hartley and I'm a psychologist here at WeightLoss Solutions Australia. And if you're looking at having an ESG procedure, my role within that procedure is pretty much the same as any other procedure. Initially we do a little assessment where I'm looking to get to know you a little bit. I'm looking to find out a little bit about you, sorts of things, maybe your past struggles with weight loss, how you might have coped with that, what your triggers might be in that area, all sorts of things around your weight and your family life, your work-life balance, your relationships, family dynamics, and what your goals and expectations are as well in this whole process. There's lots of things that can contribute to that. We're looking for any barriers maybe to your weight loss, or your strengths, your personal strengths that we can highlight. And essentially to build a little toolbox of skills that you can take forward throughout the journey. Now you would have your initial assessment with me, and then generally some generic assessments are set up, or generic sessions, not assessments, where you see me post-surgery and then 3 months, 6 months, 9 months, 12 months, but they're just so you don't slip through the cracks. You have unlimited access to all of us, so use us and abuse us, as the nurse would say. We're just here to support you, and what we're looking for is to make sure that you feel comfortable, that you can come here and discuss any issues that you've got, that we can help you in any way possible. All the research says that all the people who have the most success with any of these surgeries are people who are linked into a post-operative care program, and that's what we provide. So we want you to feel completely comfortable. We want you to feel cared for and supported, and to assist and help you in any way possible. So we might be looking at making some lifestyle changes. We might be looking at dealing with emotional eating. We might be looking at dealing with all sorts of things around your eating structure and eating pattern. So there's a bit of psychoeducation that's involved, and there's lots of getting to know you generally. Everybody's needs are different, and everybody has a different circumstance and a different pattern, a different story. So it's just getting to yours and getting to know what we can do to help you with that, so that you can reach your goals, so that you can meet your own expectations of what's going to happen during this journey, and what your goals and ambitions are. One of the things I really love about this job is all I see is positive outcomes. All I see is people just blossoming. Because for women particularly, it's not just the physical weight we carry, but it's the weight of all those barriers in life that come up for us. Physiological barriers, social barriers, and those internal barriers where that fear of other people's evaluation of us can just take on a life of its own. And we can shrink our world as a result of that. You know, we don't do so many things that we'd like to do because that fear's with us every time we walk out the door. And that's a recipe for depression, because you're just not living that rich, authentic life. And one of the things I see and hear every day is people just blossom. You know, they lose their weight, and with each kilo that comes off, they find their voice, they're more assertive, they're more confident, they find their style. They don't want to be at home invisible anymore, they want to be out in the community doing everything. And I'm sure that will be you too. And you will have unlimited access to me as your psychologist, and we can talk in session in the rooms here, or we can talk on the phone or Skype, whatever works for you. Unlimited for 12 months, as often as you like.
Hi, my name's Amanda Turble, and I'm an accredited practicing dietitian here at WLSA. One of the concerns is that I won't be able to eat normally again. You won't be able to have the same portions that you were able to have in the past. However, there will definitely be not a restriction on the sorts of foods that you can have long term. We do a pre-operative diet which lasts from 1 to 4 weeks, along with 3 phases after surgery. We have the fluid phase which lasts for 2 weeks, a puree phase for 2 weeks, and then a soft diet for 2 weeks. Each of these phases helps your body to heal, but also it's very important for your brain to help adjust to the different size of your stomach capacity. After the procedure, you'll enter into a 12-month lifestyle modification program, which will help make food very exciting. We have lots of events that will help teach you how to cook and teach you all the sorts of exciting ingredients that you may not have used before. We do 4 blood tests, a pre-operative blood test and then one at 3 months, 6 months and 12 months. These blood tests help to monitor your blood vitamin levels. We have many set appointments throughout the 12 months, but we also are unlimited with how much support we can provide. So contact us as often as you need via phone, email, and we also have a fabulous nutrition support closed Facebook group.
Thank you so much for joining us on our webinar today to learn more about the endoscopic sleeve gastroplasty. We're so excited to be able to offer this procedure for you and hope that you found this information today has answered all of your questions. The next step in the process, if you'd like to start your journey into exploring the ESG further, is to make an appointment in our clinic at Weight Loss Solutions Australia. We offer in-rooms appointments, or of course you can also have telemedicine options via Skype, phone, FaceTime if you're a distance patient. So please click the button below. We'll get in touch and we'll help you start your journey. That includes meeting with our nurse, our psychologist, our dietitian, and of course Dr. Rich. We really look forward to meeting you and helping you on your ESG journey.